Time to tape the knee. And don't kid yourself, the knee is actually very, very complicated. And there's a lot of structures in the knees that can create symptoms. This taping is a good general taping. It's good for knee strains, overuse, for my runners, for my weightlifters. I also frequently use this one post-surgically for my knee replacement patients. It's great to get some blood flow in. It's great to help their muscles create some proprioceptive function again. It's good tactile cueing. It's great for people with chondromalacia or inflammation of the articulating cartilage of the knee. Basically what that means is, if the patella is not tracking right in the center and it might be rubbing on either the medial or lateral inside or outside femoral condyle, it can create some symptoms. So this helps the patella track right in the middle where it's supposed to. I use this for myself just because I think it helps the knee just feel good. So when I've been lifting a lot of weights and my knees are achy, I throw on this tape and I feel much, much better. So the great thing about taping the knee is, ta-da, it's actually a tape that you can do to yourself. So this is me taping my own leg, and I'm just trying to illustrate that I have my knee in a little bit of flexion. It's not too much flexion. We want ideally about 30 degrees, which is the open packed position for the knee. For this taping, I'm going to use 2 eye strips. I've ripped my anchor for my first eye strip. I'm anchoring above my knee, right on that quad, and notice it's directed at an angle. I'm going to rip the paper off, and I'm going to track on the inside of my knee with the tape, adding some tension, hugging the inside of my patella. And that's going to, again, help that patella track right on the inside, but it's also adding some circulation to this whole region. Okay, so when you tape, you don't want to just anchor on more tape. You want to make sure you're also anchoring on some skin as well. It's okay if it anchors a little bit on the tape, but you need that anchor to be touching some skin. So I anchor at the top, making sure it's touching some skin, not just the other tape. I'm going to peel my paper back. Good. Stop at about 1 inch from the bottom. Track the outside border of my knee. It's okay if it crosses the bottom tape. And look, my bottom anchors are still touching skin. Now here's your check. Here's how you know you did a good job on the knee. When you straighten the leg, it should make those funny little wrinkles. Okay, so the leg is not perfectly straight in this taping. It starts out in about 30 degrees. I'm going to use 2 eye strips for this tape. I'm going to rip the anchor of the first one. I anchor on the quad above the knee. No tension on that anchor. Peel the tape back. Stop at about 1 inch from the bottom. Pull the tape, guiding it just on the inside of that patella, and then again, no tension on that bottom anchor. Give it some friction, help it stick. So you end up making a little C shape or little crescent moon shape. All right, second eye strip. Get my anchor ready. Remember, you don't anchor directly on other tape. You've got to make sure it touches the skin, so plan it out. Tape it on, taping at an angle because you're planning to go around the knee. Good, and you can see I've got some skin under that anchor. So now I'm going to peel my paper off. Stop 1 inch from the bottom. Add some serious tension, go around the other side of the patella, and then end at the bottom. Good. Make sure you're ending on skin as well. Give it some friction, help it stick, and then remember, how do you double check your work? You straighten the leg out. If you've got wrinkles, you did a good job.